Welcome everyone to the Pink Ribbon Roller Coaster. We're so glad you've joined us today. We are continuing our Chemo 101 series, and today we have Lindsey Jackson. She's our nurse navigator that we've been working with. Thank you, Lindsey, for joining us again. Okay, so today we're going to talk about nausea, vomiting, and diarrhea. Nothing that no one wants to talk about, but unfortunately it is a part of this process when you do go through chemotherapy. So let's just start off. When does the nausea, vomiting, and diarrhea typically start?
So it's different for everyone. Regimens that have a high incidence of nausea, vomiting, diarrhea, you typically get pre-meds before your chemo to kind of prevent that. So things like steroids, really strong IV antiemetics or anti-nausea medications. So hopefully in those instances, you won't have any, for the first 1 to 3 days. So in that case, maybe days 4, 5, 6, moving on. For most people, it's about a week to 10 days after. Unfortunately, you kind of think you're out of the clear, and then that stuff kind of, your body's at its kind of lowest point with all the medication really working. And then you have to remember too, each time we give you treatment, the risks of your side effects go up because we're just wearing your body down each time we give it chemo. So you may not have it the first time or the second time, but maybe the third or fourth treatment, you might have some side effects happen.
Okay, that's a good point because I feel like a lot of times ladies, even though we're having this discussion about just being aware of maybe what could happen, I hear people say, "Oh, well, I didn't have any of that," after their first time. And I think that was important to note that as you continue on, because I think then people could possibly get discouraged, but I think it's just a good reminder that, hey, we're continuing to wear your body down, and just to be aware that doesn't mean you're out of the clear, but it just means that you need to be aware that it could potentially be something that you could face, I guess, down the line.
The amount of side effects you have no bearing on how well your treatment is or is not working.
That's good.
So you can't, compare your experience with anybody else's. And it doesn't mean just because you're not nauseous and vomiting, which is our hope for everybody, that your medications aren't working. It doesn't mean anything. It's just how your body's responding to the medications.
Okay. So what kind of prescriptions can you expect your doctor to prescribe for nausea, vomiting, or diarrhea?
Great question. Sometimes there will be a steroid that you're given that you take either starting the day before your treatment, the day of, maybe a couple days after. That is an anti-nausea. Some regimens have recently started adding olanzapine or Zyprexa, which is actually pretty new medication. That's something you take at night because it can make you tired. And then pretty much everyone gets at least 2 nausea medications, anti-nausea medications, things like Zofran, Compazine, Phenergan, which a lot of people are pretty familiar with.
Okay. Don't mind the ambulance. She's at the hospital. That's where we're doing this
Yeah.
podcast from. So that's why you hear the ambulance in the background. Okay, so what if a particular medication that you were prescribed didn't work? We just need to make sure that we call our nurse, call you guys, and just say, hey, this isn't working. What else? There are different options. So I think it's important to make sure you call your doctor's office, call your nurse, because no one wants you to be miserable. We want to try to help in the best way possible. So that's why you can call and ask for other options. Is that right, Lindsey?
Absolutely. And so if you are getting a medication called Aloxi while you are in treatment, that is going to be a pre-medication. It is a very strong anti-nausea medication. We do not want you taking ondansetron or Zofran for 48 hours after you receive that medication. The reason for that is they're the same drug class. And so one of 2 things happens. One, your Zofran just won't work because we gave you this much stronger medication. Or 2, for some people, it can actually make your nausea worse.
Oh, wow.
And your vomiting worse. And so if you're getting that medication, your treatment room nurses or your doctors will let you know, and they'll give you a reminder, hey, don't take this one particular medication. And they'll give you at least, something else. And the reason you get at least 2 is so that, like Tylenol and ibuprofen, when we have fevers, you want something that you can take every few hours. Go back and forth if you're nauseous.
That's good to know because I feel like sometimes, there's so much information coming at us that it's in one ear, out the other. So I think that's a good reminder, especially if you're on a certain medication, to do what the medical professional is advising you because there's a reason why. It's not just that you can't take it. You don't want to reduce the efficacy of your chemo, and you obviously don't want to make your symptoms even worse. So that was
Absolutely.
really good point to make.
Yes,
Okay,
and if
so
you forget, we write things down. Bring your bottles in. We'll write on that bottle for you. Do not take for 2 days after treatment. Whatever we need to do to help. You're faced with a lot. You're going through a lot. There's a lot of medications being thrown at you. Anything you need to do to help remember, we'll help you with.
I was even talking to a survivor the other day, and same, like she was like, I can't remember. Like maybe the doctor did tell me to do that, but she couldn't remember. And
Mm-hmm.
okay, so as we're talking about, okay, what are some ways to manage the nausea and vomiting outside of the prescriptions that you just mentioned?
Outside of prescriptions, there's over-the-counter medications that you can use. Things like ginger, peppermint, or really pretty much anything down that little aisle at the Walmart that you would use for like your pregnancy nausea. Those all work great. I had one patient swear by the frozen Cokes at like 7-Eleven and on cue, and she was like she kept one of those in her freezer because she hated taking pills. And so she was like, I would sip on that and my nausea, never got too bad. And then I had a pharmacist come through and she was like, well, it's like the old Coke syrup we used to send in. So things like that. Talk to your care team if your prescription's not working.
Mhm.
And then other things, eating smaller meals all throughout the day. So instead of like 2 or 3 big meals, do 5, 6 little meals or snacks in between, kind of keeping something in your stomach. Staying upright after you eat. There's some days where you're probably just, oh, I'm going to get up, eat something, and then go lay back down. But that's where we get that indigestion. So if you can stay upright for at least an hour to two after you finish eating, avoiding things like spicy foods, fried foods, those tend to not sit as well in our stomach. And we kind of encourage our patients, we call them cold foods. So things like cottage cheese, yogurt, um, applesauce, the little fruit cups, just things that'll sit really easy in your stomach, uh, kind of help with that nausea. Certain smells might trigger your nausea. So just learning what those are and avoiding those. I even encourage patients because like for some reason that smell of grease, like in a fast food place, really messes with you. So go through the drive through if you need a Brahms burger.
Yeah,
Absolutely. Some days you're just going to want to eat what you can, but maybe not go inside and have all that smell
yeah,
stick to you.
that's good. That's a good point. Okay, and then as we're talking about diarrhea as well, what are some ways that we can manage diarrhea?
Great. So the biggest thing with diarrhea is dehydration.
Hmm.
We lose a lot of fluid, but we also lose a lot of electrolytes with our diarrhea. So you want to replenish with things like Gatorade, Liquid IV, Pedialyte. You want to keep a close eye on any symptoms that your electrolytes might be getting out of balance. Like if you start having charley horses or muscle cramps, that might mean your sodium's low. You got to talk to your doctor about those types of things. You want to back off those high fiber foods that we normally do, to be healthy, those whole grains, fresh fruits and vegetables, nuts, seeds, all of those things irritate our intestines. So you want to eat a very bland diet. A lot of people have heard of the brat diet,
Yeah.
which is kind of what we eat when we're kind of sick anyway. So bananas, rice, applesauce, toast all sit really well. They're easily digestible. And when we're talking toast, we're talking like Wonder Bread, like white bread, nothing real high grain with a bunch of seeds or anything in it for that diarrhea.
Well, and I think I was actually talking to a patient the other day too, and she was experiencing severe diarrhea and she'd gotten extremely dehydrated. And she called her doctor and she was able to go get an IV.
Mm-hmm.
So I think that she, one of her caretakers recommended that. And I don't think she realized that that was an option. So I
Yes.
want to remind ladies that if you do get, like you just said, severely dehydrated, you need to call your doctor because that is an option if you do need to go get IV fluids. Is that
Yes. Absolutely. It's for vomiting and or diarrhea. So signs of that you're getting dehydrated, your urine's getting darker. It
right?
should be that clear, pale yellow. So if we're going dark yellow, brown, that you need to call right away. Dizziness, especially in the mornings when you stand up, when you're, most dehydrated.
Mm-hmm.
If your skin starts to look really dry and pale, you feel real dried out, like in your mouth. Those are all signs that you could be getting dehydrated. Yes, absolutely call your doctor and most facilities can give you IV infusion either with your treatment or in between treatment.
Now, when you just mentioned that about the sodium, what do you do for that?
Those electrolytes.
Okay, so just
Yeah.
having the
Some
electrolyte
some
will be
kind of whatever, and I just tell people
sodium.
whatever. Some of them don't taste good, so they won't, use them. Pedialyte makes popsicles now.
Yeah.
Just whatever is going to taste good to you that's got a little bit of that potassium and sodium in it. Yeah.
Okay. I like the liquid IVs, and they have sugar free too.
Hmm.
So I think they taste really good.
I do
Um,
too, and there's so many different flavors.
yeah, I know. Okay, so you said when to call the doctor would be if you have excessive diarrhea, if your urine is, brown or dark yellow, if
Hmm.
you're vomiting. Are there any other reasons that we should call?
Well, for with the diarrhea too, you want to remember diarrhea is normal
Okay,
with treatment, but more than 6 stools in 24 hours is too many.
okay,
Any diarrhea that you are not able to make it to the bathroom with, you shouldn't be having accidents, and it shouldn't be waking you up in the middle of the night. And then
okay,
any blood that you see in your urine or your stool, those are
okay.
calls to, yes.
That's a good point because the patient that I was talking about, she had asked me that. She was not able to get there. So
Yeah,
that's a good indication that
yeah.
she should.
And I tell all my patients, Imodium is your friend. Call your doctor first, but
Mhm.
they will have you start taking an Imodium and listen to the way they tell you to take it. A lot of us don't take it as much as we can. And once it seems like if we can get on that regimen correctly, that will, relieve a lot of symptoms for people.
Okay, so if you do start taking Imodium, is there a possibility of constipation?
There is, and that's why you back off of it the minute your diarrhea stops.
Okay. Okay.
Yeah.
So it's just kind of a buffer to be able to manage that symptom to get it to slow down.
Yes.
Okay, so now let's say you are constipated. What are some ways to manage that?
Great. Physical activity as much as you can tolerate. Just walking. Walk down to your um, mailbox or around your house a little bit. Lots of fluids. You want at least 8 8-ounce glasses of preferably water a day, but we encourage no caffeine and no alcohol in those beverages. Um, if you are constipated, we want to up our fiber. So we want to add back in those green leafy vegetables, those whole grains, those fresh fruits. And then, especially people prone to constipation or folks taking narcotic pain medication, please manage your pain. It's very important. If you are hurting all the time, your body is busy dealing with that instead of able to really kind of fight your disease. But know that if you are on narcotics, there's a very high risk for constipation. So typically, I tell my patients, if it's been kind of one day past your normal, so if you're normally going every day, but you're going every other day, or you feel bloated, or you're really straining on the toilet, you need to let your doctor know. They're going to start you on something like, Dulcolax, Miralax, Colace, and then there's other things we can and move up on if you are struggling with that constipation.
Okay, so I've heard people talk about through different, I guess, holistic methods that you can do what are called colonics. Would that be something where it's cleansing your colon? Would this be something that you'd want to do while you're on treatment if you are
No,
constipated?
because there is a risk for infection. So
Okay.
we don't want anything like enemas, colonics, that where anything could potentially perforate that really thin tissue in your anus
Okay.
and introduce infection.
Okay.
Obviously, if it's something that you really, really want to do and you feel like you have no other choice, discuss that with your physician. But typically, we want to stay away from anything like that during treatment.
That's good to know because I know that some people are just looking for relief. So that's
Absolutely.
what you want to take. So I'm glad that you suggested that. Okay, so was there anything else that you thought we needed to discuss with nausea, vomiting, and diarrhea?
I think the main thing with the nausea vomiting, remember, it's much easier to stop yourself from throwing up than to stop once you start throwing up. So I know you women, you are strong, you're caretakers, you put yourself on the back burner. Don't do that with this nausea. Don't try to power through it. First sign of nausea, you take something, whether that's your prescription medication, something over the counter, you get some food in your belly, you get some fluids in you, something. Address it before you start throwing up. And then what if you do get to the point where you are throwing up, normal things we do for throwing up, cold compresses. You want to do clear liquids until your vomiting resolves, making sure you're staying hydrated and, resting and having grace while you're not feeling good.
Thank you, Lindsay. This is great. Ladies, like she said, don't push through it. Make sure that you are contacting your physician, your nurse, because there are ways to try to help these side effects because they're doing their best to try to help you guys get through this in the best way possible. We don't want anybody to be miserable and they don't have to be. And you, like you said, you are strong and you are going through a hard battle. There's no reason to make it worse. So I hope that you guys learned something today, and we'll see you guys next time.